presenter is the chair of our cost action, Dr. Inge Santman. She is a senior veterinary epidemiologist, and she leads the epidemiology group at GD Animal Health in the Netherlands. Her main focus is on monitoring and surveillance of cattle health. She is responsible for innovation projects, and she is also responsible for the developments of products. And these products turn large amounts of data into the valuable information for stakeholders. So during this cost action, we got to know her as an enthusiastic and inquisitive researcher who is always committed to high quality research. And her main goal is to, and which was also reflected in our cost action, is to contribute to livestock industry that focuses on prevention rather than cure. So, and with this in mind, I am pleased to invite Inge to present the results of the sound control cost action. Inge, the floor is yours.
Yeah, thank you, Tanya. So thank you all for being here today. And I'm going to present the results and outcomes of our sound control cost action, which are quite a lot. So I hope that I can be able to take you through them rather quickly, and also show you what we did and what we achieved together with a whole group of researchers from 33 countries. And that we can also, well, direct you if you are in need of more information about this topic in the right way to our website, where you can find all the information. So with that in mind, I would like to welcome you to this final sound control webinar, which is called Moving Towards Output-Based Surveillance to Control Non-Regulated Cattle Diseases in Europe, where, well, as you can see later on, there's quite some discussion on what the definition of non-regulated is. So why did we start this project in the first place? Well, for a number of cattle diseases, each country has its own control program. So, for example, diseases as FMD are completely regulated by the European Union, and it's prescribed what you have to do when you want to control the disease and want to prove a free status. But there are also a number of cattle diseases where this is not the case. For example, when you look at BVD, it's not mandatory to have a control program, and not all the countries have the same control program. However, it is good, and we want to support disease control in European countries. So, however, when each country has its own control program, this has the advantage that the control programs are tailored to the specific context situation. So, for example, when we talk about the Netherlands, in my country, we import quite a lot of cattle, and we have a high density country. So perhaps, well, we think we need a different control program, a stricter control program than in comparison to countries that do not import any cattle and where the density is lower, for example. So we think that it is good that control programs are there and that they are tailored to these specific situations. However, this also creates some challenges, because how can we compare the results if programs are different? And which control programs works best in which situation? So for countries that are thinking about controlling diseases and are not doing that yet, which control design should they choose? What would work best? So that were questions that we kept in mind when starting this cost action. So we initiated a cost action with the aim to coordinate, stimulate, and assist with initiatives to explore and implement output-based surveillance applicable to substantiate the confidence of freedom and cost effectiveness. So that's quite a large aim. But well, as I think many of you already know, cost actions stimulate networking, so they aim at networking, but they only provide funds for travel and accommodation. So they do not fund actual research. There are other means for that. However, there is some money available for research to visit each other and to work on a topic for a short period of time, for a few weeks or even a few months. And these missions are called short-term scientific missions. So therefore, we aim to coordinate and stimulate. We are not having the aim to create an output-based surveillance system that is ready to use. However, we want to stimulate countries and researchers and stakeholders to move towards output-based surveillance. So not judging programs on whether or not they comply with the inputs, so the type of test and the test frequency, etc., but more on the output. What do they prove, and can they prove that they are free from certain diseases? So this was a 4-year cost action, which started on the 29th of October 2018 and finished on the 29th of October 2022. And over more than 100 researchers were involved in 33 countries throughout Europe, and also Canada was included. And you can see it in the map on the right bottom of your screen. All the countries that are colored either light green or darker green, those are the countries that were included in this cost action. So it's almost all of Europe. And we worked in 5 different work groups. So here's a description of the 5 work groups. So work group 1 had the task to describe the control programs that are there in the different countries that participate in this cost action. And work group 2, they focused on, okay, if we want to move towards output-based surveillance, how are we collecting data in the different countries, and how are we going to make sure that these data are comparable? So they looked at definitions, they created forms, we discussed the forms, but I will go into that in more detail later on. Work group 3, that were researchers that focused on, okay, what methods are already there that could be used in output-based surveillance, and what are we still lacking? Do we miss methods, or are the methods too complicated, or are they ready to use? Can they be used in all situations? So things like that. Then all the gaps that were identified in work group 1, 2, and 3, they were collated by work group 4. And they also looked at, okay, what is needed for future implementation? So they took it a step further. They also looked at social factors, but also at, okay, what are stakeholder needs and what are farmer needs? So that was the focus of work group 4. And work group 5 was purely focusing on the communication and dissemination of the results of our cost action. So I would like to take you through every work group very shortly and present you with the most important results and direct you to the right place if you want to go into it in more detail. Because we are simply, it was a 4-year project, so there are many, many results. So I will just highlight some of the, I think, most relevant results today. So first, when we look at the outcomes of work group 1, the description of the disease control programs, there were 5 people that were managing this work group, and this was, well, a very large work group that explains the large amount of people. So the work group was led by George Gunn from SRUC, and he was supported in the first years by Jörn Gateman from FLI and Sam Strain from Animal Health and Welfare Northern Ireland. And then there were younger researchers that were very enthusiastic and took up a lot of tasks in this working group that were Jaka and Madeleine from Slovenia and from the UK. And at the midterm of the project, we decided and asked them if they would want to co-lead this work package of this work group, also to give them some management experience. But also they did a lot of the work and we wanted to reward them. So in the end, we had a group of 5 people that were really the drivers of this work group. So what they did was, well, first they want to describe all the control programs that were run by different countries. However, we had a lot of discussion, okay, what is the definition of a control program? When is it control? and when is it surveillance, and when is it active surveillance, and when is it passive surveillance. So together with all the people of the consortium, we created a sort of a flow diagram to discuss, okay, what are the definitions and how are we going to call the surveillance that we have in the country, so that when we describe the control programs in place in the different European countries, how are we going to make sure that the definitions are similar, and that we are talking about an eradication program in country A, that it's the same definition as when we are talking about an eradication program in country B or country C. So together we created this flow diagram to sort of, well, make sure that we align the definition of active surveillance, passive surveillance, eradication program, disease prevalence, so in the endemic situations, etc. So that was sort of the basis, and then we asked countries, okay, so what are you doing with regard to disease control? For how many diseases do you have a control program or an eradication program, and what is the status of the diseases? So that resulted in a whole bunch of these maps, where we looked at, okay, how many diseases that are not listed on the A or B list of the new animal health law, how many of the diseases are controlled per country. And there you can see, when you look at the output or the results, there you can see that in Sweden, Denmark, and the Netherlands, most diseases are controlled. And then when you look in the Eastern European part of Europe, very often not many diseases have an official control program, but you can see a variety of disease control throughout Europe. And we wrote these results in a paper because we even took it some step further, of course. We summarized, okay, which diseases that are not listed as A or B are controlled most often. And then EBL, leukosis, was the #1 controlled disease, blue tongue. But of course, this one was always already listed. So that one is controlled very often. Then IBR and BVD are controlled very often. But when you look further down the list, for example, even bovine coronavirus infection is controlled in one of the countries, and BRD is controlled in 2 of the countries. So the diseases on the top list are very interesting, but also the diseases more towards the bottom, because we also provided maps that show you where the disease is controlled and where not, and at which stage of control the disease is. So if you are thinking to control a disease that is not controlled yet in your country, but is controlled in one of the other countries, you can search that very easily in the information that we documented and published online. And then you can contact those countries, and perhaps learn something from those. So does their control program perhaps also fit your own situation? So what we did is we wrote those results in a paper that we published in Frontiers of Veterinary Science. So the overview, the results that I presented in the previous slides are all included in the paper. The overview of the cattle diseases listed on the category C, D, or E. And we also created a dashboard with easy access to all the information. So when you go to our website, and the website name is published further on, but it's www.soundcontrol.eu, and perhaps Tanya, you can type the name in the chat. You can access the dashboard very easily, and you can just filter on the country or filter on the disease, and you can find all the information there. And it's updated. The last update was last summer, so it's still quite recent. So what we did with Workgroup 1, we opened a special issue in Frontiers, and we published over 20 papers with with publications describing control programs in the participating countries. So the paper I just mentioned is sort of a summary over all countries, but there are also a lot of publications which describe the different papers in each of the countries participating, so provide more detailed information. So that is also something that you can find on our website, because here you on the left bottom you can see a print screen on the homepage of our website, and there you can see a very easy link to download the ebook with all the papers, but also a link to the dashboards, the Our Shiny app, where you can find all the detailed information as well. So that were the most important results from Workgroup 1 that we published. So when we move on to Workgroup 2, the collection of data, this workgroup was led by Gerdien van Schaik from the Netherlands. She works at GD and University of Utrecht, together with Céline Vavillon from Ausfeld in France. And what they did, they developed a data collection framework, which is generic enough for a lot of, to apply it for a lot of diseases, but also to be able to apply it in a lot of different countries. So what we first did is we started by creating a data collection framework in 6 Western European countries and for 1 disease. So for BVD, and this was done as part of the Stock-Free project. So we did it for BVD in France, Ireland, the Netherlands, Sweden, Scotland, and Germany. And then we took that first data collection framework that worked for 1 disease and for 6 countries, and we extended the data collection framework to make it more generic, so that it could include data for multiple diseases. So, and what we did, we tested it for 3 diseases, for BVD, for Johne's disease, and for IBR. And then, of course, well, then we had this data collection framework, and it worked for 3 diseases and for the 6 countries, but then we extended to a broad range of the 32 countries that were at that time involved in our cost action, to make sure that the data collection framework was not only suited for application in Western European countries, but also for South European countries and for East European countries. So to make sure that it cannot only include data from 1 system, but from all the systems that are there throughout Europe. So then we had that data collection framework, and of course we tested it in all our countries, and we developed an ultimate online data collection tool that is also freely available and published on the website. So what we did is we started the data collection. The final tool consisted of data collection through a fairly simple survey. And that survey is created in different formats so that it's usable for everyone in every country. So it's available in Word, in Excel, but also online. And what we did is we wrote publication first, what we learned from the development of this generic data collection tool to support this assessment, and then what we found in the data. So when we look at some results, I think an important thing that we learned is that there is information that is need to know to run your model and to get confidence about the probability of freedom from diseases, but there's also information that is nice to know. So if you are going to ask people, okay, what do you want to know to trust a free status of an animal in a country? They will give you a lot of information of a lot of needs. They want to know everything. But in the end, when you look at, okay, but what is the essential information, then you need not as much information as you beforehand think you need. So what we included in the final model or in the final data collection tool are the things that we think we really need. And so we include a section on demographic information, so the context, and we include variables as, for example, number of cattle, but also things like import, perhaps sort of presence of risk factors. And after we included the variable, we give the definition, and we try to make the definition as clean as possible, and we agreed with each other on the definition. So this seems very simple, all cattle older than 1 year, but we have had some discussions to come to this definition and to include exactly the age of the animal in this, to be sure that everyone have the same definition of, okay, what do we mean when we are talking about the number of cattle? So the type of data that we want is the number of individual animals, and then the data that is available can be data of all cattle, and in some countries it is possible to distinguish all cattle into dairy and non-dairy, but that's not always the case. And then we also ask for data strengths and limitations, so to get some more information on the quality of the data. So that's an example. So what we did, and I'm not asking you to look at or read this whole table because I know it's too small, but what we did first was we evaluate the data availability and the quality for BVD in the 6 countries. So what we had, we already had the sections cattle demographics, cattle control program, and risk factors. And what you can see when you look at the table is that when you see a green color, then we know that there's a lot of information available from either all or from most countries. And that the definition of data available is quantitative data available. When there's less data available for less countries, it got the color yellow. And when there's almost no information available, we colored the section red. So what you can see and have to learn from this picture is that, well, when you are talking about cattle demographic, there's a lot of data available. Control program, a little less, but still quite a lot. But when you are talking about risk factors, we see that there is a gap, that from a lot of countries, there's no quantitative data readily available to provide information on the prevalence of different risk factors at certain time periods. So this was still the first evaluation, because when you look at, or when you expand that data collection to all the countries that were included in our cost action and do the same exercise, you can still see that when you look at demographic information, that most countries have a lot of information, but still not all of them. When you look at risk factors, you see that the maps are colored quite red. So what information are we lacking when we are talking about output-based methods? Very often information on the prevalence of risk factors. However, when you then look at, okay, but what do we know about the control programs? Now, then we know a lot of information for BVD. Not all countries, but still there you see quite some green. For IBR, still quite some green. And for Yonis, it already gets a little worse. But sometimes risk factors and presence of risk factors is reflecting in what you see in the control program. So if you have more risk factors, you will see a higher prevalence or more herds that are newly infected, for example. So sometimes information of risk factors can be replaced with with information about the disease control programs, but not in all cases. And here there's still a lot of work to do. And in fact, during our cost action, there was another cost action that started, which is called Cost Action Better, and they focus on biosecurity and also on these risk factors to get more information. So hopefully in the near future, well, we will see a lot of green here instead of yellow and red. And also these results are published in the paper, which is part of that special issue and freely available for everyone who is interested. So then we look at work group 3. So if we evaluate, okay, what methods are already there and what gaps are still existing. So this work group was led by Aurélien Madouas from Oniris in France. And he was supported by Eleftherios from the University of Thessaly in Greece. And they were the true drivers behind this working group. And what they did was they tried to identify the gaps that were there in existing methodologies. And they also looked, because, well, existing methodologies are not always focused on output-based surveillance. So they also look at the possibility to adapt existing methods in veterinary science for standardized comparison of disease control programs. So what they did was they defined requirements. So when is a method fit for purpose, fit for output-based surveillance? And they created some requirements so that the question that was addressed was clearly posed in quantitative terms. They acknowledged that different contexts require different methods. So, for example, an endemic situation requires different statistical methods compared to a situation where a country is already free and there are no new infections anymore. So, well, you need a method that can deal with the fact that there are no infections anymore. So, looking at a free herd in an endemic situation requires a different method compared to a free herd in a free country. The different criteria to take into account in the choice of a method need to be clarified. And they acknowledge that different methods generate different types of output and are not always providing proof or the confidence that a herd is free in a specific situation. So sometimes the methods need to be adapted. So what they did, they came up with a table where they said, well, when we evaluated different methods, we looked at what are the hypotheses, is the disease absent or present, what is the objective of the method that can be resolved with the method. So for example, when the disease is absent and you are in a free situation, and you want to quantify the probability that the true prevalence is below a chosen design prevalence, so that, for example, it's never possible to guarantee with 100% that free is actually free, even in a free situation. So you always have to say, okay, what if we want to prove freedom given that the prevalence is below a certain level? So below a 1% level, for example. So below a chosen design prevalence, they call that. So in this case, the best suited method that they came up with are scenario tree models. So they defined, okay, what inputs does this method require? And what are you getting as an output? So when the disease is prevalent, and you want to answer the question, or you want to identify units with a probability of infection sufficiently low to be allowed to sell animals. So what is the probability that a free herd in an endemic situation is truly free? You can use different models of different methods, which require a slightly different input and provide you with an outcome. So in this information and this table and the results and the gaps that they found, they also wrote it down in a paper. The information is already available on our website, and hopefully the paper is in the second round of review. Hopefully it will be accepted soon, and then it will also be open for everyone that is interested. So when we look at the gaps and need for future implementation, this work group was led by John Berezowski from SAUC in the UK, and he was supported by Maria and by Lewis. Maria from Animal Health Ireland, and Lewis from, well, first he worked in Switzerland at the University of Bern, and then he moved to the National Veterinary Institute of Norway. And what they did, this group did, they developed, they wanted to develop a research agenda at the end of the project. So they thought for them that they were sort of sailing a ship, well, and they want to get to a very nice endpoint with a clear view and everything is clear and finished and correct, and their starting point, well, was not really looking at the endpoint. So there was already a lot of information available and a lot of data, but there was also still a lot that needs to be done. And they wanted to quantify, okay, which gaps are still there, what can we resolve during this project, and what do we take with us from this cost action in a research agenda for future development. So what they did is they identified start and end points, they identified gaps, and they defined what research needs to be done to overcome those gaps. Well, and then during this road, there were some challenges, and I think the main challenge, which is sort of reflected either by, well, this rock or the lightning, but was of course the whole COVID pandemic, which really make it more difficult for specifically this group, because they were planning to do stakeholder engagement workshops and in all countries, etc. And well, they could not proceed with that, so they had to come up with a different plan to come to that endpoint. So what they still did, was a starting workshop with people of the consortium and asked them, okay, what information do we desire, do we need to trust an outcome of a control program? Further, they started conducting a lot of SDSMs, so those short-term scientific missions, where especially younger researchers visited research institutes in other countries and worked on a topic. And a very nice collaboration was where a Dutch researcher went to Nottingham to the group of Jasmeet Kaler, and she looked into the social and ecological determinants of farmer behavior and how it relates to livestock disease control program. So she looked at the gaps and what is already there, how many researchers look into farmer behavior and attitude, and how does this relate to disease control, and what is still lacking. And she wrote that work in a paper which was also published. And that was the start. And of course, then COVID kicked in, and it all became a lot more complicated. But first, well, what she mainly found was that most studies on farmer behavior were conducted in Europe, so are relevant for us and also for this topic. However, I also think that it's good to know that this work is mainly conducted in our continent. So there's still a lack of a lot of continents where they are not looking into farmer behavior and attitude. Well, I think it has been proven that there's a clear link between attitude and what farmers are actually doing. So it's a different thing to know the risk factor or to act on it. And she very nicely highlighted that in this roadmap. And she also found that there's an increasing attention for farmers' behavior in the last decades. So when you look at the number of publications between 1995 and 2020, you see that increasing numbers of publications on this topic are published, which is, I think, very good. So then that was that. And then, of course, COVID kicked in. So instead of organizing the stakeholder workshop, we decided to make a questionnaire, a short survey in which we asked stakeholders information on what do you need when you want to evaluate control programs, or when you want to trust the status of a disease control in another country. So this work was conducted during a virtual mobility grant. So in that case, people stay in their own country, so do not need to travel, but all contact is virtually. And this was coordinated by Rachel. She did this virtual mobility grant, Rachel Kerf. And what she did was she created a qualitative survey, and then all the partners in the consortium collaborated. I think partners from 14 different countries collaborated by setting out the survey, translating it to their national language, setting it out among their stakeholders, collecting information, retrieving this information, translating that information into English, and sending it back to Rachel. So when you look at, okay, who replied in the survey, you see that there were a lot of industry people involved. So from the beef industry, the dairy industry, breeding associations, cattle trade, private practices, but also people from the government, animal health organizations, academia, National Reference Institute, and other. And of course, there were a lot of results, which again can be found on our website. But to highlight two of these results, when Rachel asked the questions, there are disease control programs in my country that in some way discourage the import of cattle from certain other EU countries. And then the answers could range from strongly disagree to strongly agree. And you can see that there's still quite a lot of variation between countries. And then for the people who are wondering why it says here without Poland, well, that was because Poland did very well. So they had a very high response rate, especially a lot of government representatives that filled in the questionnaire. So Poland was a little bit overrepresented in our questionnaire. So we conducted the analysis with or without that country. But well, they actually were sort of the best in this because they were able to get a lot of replies. And another interesting result was disease control program have an important role in building trust. And there most countries agreed and most people agreed that that was a very important. So also relevant. So you are not only controlling diseases to improve your disease status of your country, but what we learned was also that when you are controlling a lot of diseases in your country, then other countries will trust you more easy and have a lot of trust in your status. So then we did a similar exercise with farmers. So again, we created a questionnaire. Unfortunately, we could not visit each other. So in this case, Nienke Paalberg, she's from the Netherlands. She she coordinated this work where a questionnaire was designed in a short-term scientific mission done by Jalil from Albania. He developed the questionnaire together with Irish partners, and then Nienke, she set it out, and 7 countries collaborated in this and set the questionnaire out in their country. And again, a lot of work involved with translating questionnaire, collecting answers, translating it back and sending it to Nienke. And again, a lot of information, and just here a few highlights. So when you ask the farmers, you see that, well, when you look at the response rate, that there were a lot of responses from Ireland, the Netherlands, 88 usable responses, Estonia 100. So it varies, but from 7 countries we got replies. So to highlight some results, when we ask, does the disease control status in your country influence the countries you're trading with? So when we ask this to the farmers, you see some variation. So especially here you can see the blue colors indicate strongly agree and agree. And you can see that, well, the Netherlands, a lot of farmers in the Netherlands agree or strongly agree, and the same holds for Ireland, Estonia, Italy. But when you look at Albania, the situation is different there. And that probably is also related to the fact that they are not controlling as many diseases as in the Northern European countries and in Italy. And when we ask who influences the decision-making regarding imports of cattle, you can see that there were quite some differences between the countries, although sometimes the response rate was very low because this question was only asked to people that were in fact importing cattle. And you see that in the Netherlands, there were 30 farmers who imported, but in Portugal, only 6. And in Ireland and Estonia, also very low numbers. However, it was still interesting to see that, for example, in the Netherlands, the cattle trader plays a large role, and in Albania, there's a large role for the veterinarian who has an influence on the decision whether or not to import. So what we saw with farmers, that there were a lot of differences between farmers in different countries, and sometimes also between different herd types. So for example, that dairy farmers had other opinions than beef farmers. And unfortunately, the time today is too short to go in detail into that. But there's already a report on published on the website with a lot of information. And if you need more, you can also contact us. And we are in the process of trying to publish this work. So, and then the last part, of communication and dissemination, which is led by Tanja. You all saw her in the beginning. She's working at the University of Ljubljana in Slovenia, and she was really the lead in most of the communication and dissemination activities, and also in, well, making sure that everything looks very professional and very nice. She was the driving force behind the logo, etc. And she was supported by Egle Rapeliuta from Lithuania and by Lina Costa from Portugal. And what they did were they were the driving force in a lot of the activities included in the action. For example, they developed the website, the logos, but also coordinated the meetings and the training schools. And it all seems, well, that's not a lot of work, but actually I think it's most of the work to make sure that everything is communicated very well and organized very well. During this cost actions, we organized 2 training schools. Again, materials can be found, and also a lot of recordings can be found about the 2 training schools. So the first one was on monitoring and surveillance. And in the end, due to COVID, it was an online training school. And we also organized a training school on scenario tree models, because our participants in our cost action indicated that they want to learn more about it. So we used the cost funds to provide the training school on that topic. We had, of course, given COVID, a lot of online meetings. And what we also did was we developed our own YouTube page. So we created a lot of content during this cost action, but also we had the countries that had their own control programs, and we provided them with a platform to present their control programs. We recorded those presentations and we published it on our YouTube page for others to see it. So in the end, we organized 11 webinars, and we created 5 newsletters with summaries of our most important results, and also the experiences from the people that participated in our cost action. So where can you find the information? Well, the information can be found on our website, www.soundcontrol.eu. You can find there the buttons. You can see here, this is again a print screen of the homepage, and you can find 3 buttons here. One of these buttons links to the YouTube channel, where you can find all the recordings that were made during our cost action. So sound control in 2 minutes. So a short presentation of, okay, what did we do? What did we achieve? But also information, recordings on the monitoring and surveillance training school, but also all the webinars. So just have a look and use the information as you see fit, because it is there to be used. And of course, well, the link to the Our Shiny dashboard. So then we had this action and we worked together for 4 years on this topic. So what do we conclude after our 4 years of sound control? Well, what we concluded was the control programs for diseases that are not strictly regulated on an input-based manner by the EU are often tailored to country-specific situation. And why are they tailored in this way? They are tailored because the aim is very often to manage the risk in the most cost-effective way, given the situation at hand. So for example, in the Netherlands, we have a high risk for introducing diseases, but we also have a very good infrastructure. So we have census data of all the herds. The data quality in the Netherlands is very high, and we have routinely milk collections, bulk milk collections, and we can use those bulk milk to test diseases on. So we all use those things in the designs of our control programs. While for other countries, for example, for Sweden, that have a lower risk when you look at import, are already free from a lot of diseases, they design their programs in a different way to make sure that they are managing their risk, but also in for them the most cost-effective way. So they are more focused on control of importing animals, where we in the Netherlands, we are focusing on control of bulk milk, for example. So that's sort of, well, it seems logical, but it's also sometimes a real eye-opener that countries differ greatly in context and risk, but also in the number of disease control programs for non-mandatory controlled diseases, as you can see in one of the first slides that I showed you. And if they control the diseases, there's also a large variety in the designs of the program. So with that, we do believe that output-based surveillance is and remains very relevant, because we would like to conduct our own programs that work the best in our situation, but also that the result that we are producing, namely free herds and free population, is acknowledged also in other countries. And for that, output-based surveillance is the way to go. So what we also learned, that when we as researchers think about, okay, what do we want to know before we trust the status of imported animals, we see that we want to know a lot. We want to know everything. However, first, not all information is readily available in all countries. It depends on the system and what is already collected or not in a uniform manner. But there's also a difference in between what do you really need to know. So what is actually telling you giving you information about the status of the herd or the status of the animal, and what is nice to know. You really want to know it. You are really interested in that information, but it does not really directly influence the disease status of a herd or an animal. So we need to focus on the important and influential parameters. And what we found, that models can only include limited amount of information, which might be okay, because, well, we cannot, as I said in the previous slide, collect everything and want to know everything, because then it's fairly more simple. Then it's more simple just to test that animal. So had to never trust each other. But I believe there is a way to meet in the middle. So we need to include the relevant parameters, and we also only need to include the relevant parameters in our model, because otherwise the models will not run technically. They will become too complicated, too slow. So we have to be selective. In addition, the model of the method that we are selecting is based on the status of the country, because you need a different method when your country is free than when your country has an endemic status for certain diseases, and the level the model is applied to. So do you want to model something on country level or regional level or herd level or animal level? That all influence the method that you need to use. And we concluded there's no readily available solution for all situations yet. The models that are there so far remain fairly complicated and have to be run by specialists. And of course, this is possible. However, stakeholders, not all stakeholders have access to this specialist. So then in that case, we discussed that perhaps organizations as universities or animal health organizations have to run the models and then agree together across countries to publish all the results on easy accessible websites so that every stakeholder or every farmer can have a look at the website and see what the true status for a certain disease in a certain country is and what the corresponding risk is when he wants to import cattle from those countries. Furthermore, we found that in the end, it's all about trust. And when we, queried the farmers, we also learned that sometimes it is not about trust, but just about price, because when it's some farmers just see a very good financial opportunity and don't care about status. But most farmers and all the stakeholders say, well, the important thing is trust. And then you see that countries with a proven higher health status that are controlling a lot of diseases are trusted more easy. So what we found is when we asked the stakeholders and also the farmers that the Scandinavian countries are highly trusted, for example, and Germany is highly trusted. So what will be the next step? Because this action has come to an end. So what are we going to do next? Well, we believe that with this network, we found the gaps, we organized it, we summarized everything and the next step in a research agenda that we published. So the next step will be to find some research funding to be able to address the remaining gaps that there are, that are present. So perhaps also have a look not only in the social factors, but also more in the economic factors. And how can we take this a step further, not only from, okay, we need different methods, but can we create something that countries can just fill in the data and the data collection tool, click the context situation and fill in the whether a disease is prevalent or absent, the name of the disease. So some meta information and that then the model is run on the background. But we really need to make additional steps for that. Of course, there are already some output-based methods. So the latent class models, Bayesian models, but also the scenario tree models, and also during this project, stock-free output-based surveillance model was developed. So we want to promote the output-based methods that are already there, and we really urge you to use them to show the output of your disease control programs. And we are currently already using these methods ourselves to evaluate our own programs and to, identify the gaps that are still there. So, and to conclude, this was a cost action. So again, as I said, only funds for networking, for travel and accommodation. So every researcher in this group had to spend their own time, invest their own time in this project. And what I found as chair of this project was that it was very remarkable what can be achieved with a group of enthusiastic people, even when, there's actually no funding for your time. So, so with that, I know that, at least some of the people in the consortium are also here today. So I would like to thank everyone very, very much for all their inputs and all the information that they provided and all the tasks they conducted in their country. And here you can see a very nice picture of a final conference in Greece last September, where a lot of people were finally meeting again together for the first time after almost 2.5 to 3 years only online contact. So, so with that, I would like to conclude my presentation. And thank you for your attention. And with that, I think the floor is free for you to ask questions.